everyone, this is Check TV and you're welcome to another episode of Health Talk on Check TV. Today we'll be talking about hernias, and speaking to us is a resident from University College Hospital, Ibadan, Dr. Amusat. So sit back, relax, and let's learn some things.
I am Dr. Olarenwaju Amusat, a resident doctor in the Department of Surgery, University College Hospital, Ibadan. Hernias occur when an internal organ protrudes through a weakness in the muscle or tissue that covers it. It's a common condition amongst people. It affects both the young and the old, men and women. The cause of hernias are not entirely known. What we know is risk factors, and these risk factors vary from individual to individual. And one of the risk factors is lifting heavy objects, having chronic cough for a long period of time, being constipated, having difficulty with urination, and surprisingly, hernias also run in families. Those that have familial predilection for hernias tend to develop hernias. The hernias could affect different parts of the body. It could affect the groin, it could affect the umbilicus, it could affect several other parts of the body. But the common ones that are encountered are the groin hernias and the umbilical hernias. The presentation varies depending on what the state of the patient is. For those that present early when the hernia still is not yet obstructed, that's where the internal organ still appears and disappears intermittently. They could just come with just that protrusion alone. However, if the hernias are not treated on time, the hernias could be obstructed. At this point in time, the person could present with swelling of the tummy, pain in the tummy, the person could be vomiting, and in that case, what usually happens is the fact that the obstructed intestine, in the case where the intestine is what is involved in the hernias, the obstructed intestine could have lost the blood supply and then it is dead. Treatment is mainly surgical because there is no drug that can treat hernias. We see a lot of things on social media where they will say they are taking hernia herbs and other things. Those things don't work. So the treatment for hernias is surgical treatment. So what the surgery will do, we said earlier that the problem is the fact that there is a weakness or a defect in the covering of an internal organ, such that internal organ now protrudes through that weakness. So what we want to do is we want to return the part of the person's internal organs that's protruded. We want to return it back to where it is supposed to be, and then we want to strengthen that defect. We want to repair that defect such that the organ does not protrude again. So the treatment could be in three forms. It could be open surgery, where the person is cut, that the part where is protruded is cut open, and then the internal organ is put back in, and then there is a repair of that defect. It could also be done laparoscopically. That's the minimally invasive procedure, wherein there are just small incisions, small cuts that are made around where the hernia is, such that the hernia is reduced. But that is not very common in most parts of the country. What we have is mainly the open surgery. And then the third form of repair is what we robotic repair. The complications could vary from the fact that the hernia itself, as I said earlier, could be obstructed. It could lose its blood supplies. And one of the complications that we could have is recurrence. But the hernia has been treated doesn't mean it cannot recur. So one of the things that could cause recurrence is if the person is exposed to risk factors that have caused the hernias in the first instance. So it's important we take care of those risk factors such that recurrence don't occur.
Thanks for watching to the end of this video. I hope you have learned one thing or the other. Don't forget to like, comment and subscribe, and also share to your friends and loved ones. See you in the next episode. Until then, stay healthy.